Hi, this is Junaid with another video. Today we're going to discuss machine learning in healthcare, a primer for physicians. This is the most important technology of our times. And if you look through the past, how technology in health IT has basically been implemented and physicians have been sidelined, today we're going to discuss all those things and move forward with further applications of machine learning in healthcare. I don't have any relevant disclosures for this particular topic. However, non-FDA approved products would be discussed not only in this lecture, but also throughout the series. Before we start, let's just break down how I'm going to do this whole series. The first primary heading is basically machine learning, a primer for physicians. I'm going to discuss the Prelude, which is the current presentation, which includes mainly why even implement AI, and what have been the hurdles with health IT, and how things like EHR, which is basically a billing engine, have impacted us, and what to look forward to when we are talking about machine learning in healthcare. The next topic will be overview of machine learning in healthcare. I'll break down how the progress has been through different technologies and how it is going to change and impact healthcare, and the amalgamation or cross-disciplinary application of different kinds of technologies in health IT will impact us. Then I'm going to move to technical basis of healthcare, which I will discuss what really machine learning is, what are the basics of it, and how are the different flavors of machine learning being applied in healthcare. Then I'm going to set out 6 principles of machine learning in healthcare. I'll go into how these principles need to be adhered to for proper implementation, and then also require a deeper understanding of how evidence-based medicine will be impacted by it. And therefore, these principles will help us implement machine learning in a far patient-friendly, physician-friendly way. Lastly, I'm going to discuss challenges and limitations of machine learning in healthcare. In this, I'm going to point out the different challenges in different areas like data, security, empathy, medical legal issues, etc. Then I'm going to start a new series, and this will actually highlight examples of machine learning in healthcare. The first, I'm going to start with neurovascular disease because I'm a neuro ICU physician and a stroke physician. And then I will break it down into applications in acute ischemic stroke, cerebral hemorrhage, and then etc. The objectives of this particular prelude is basically to recognize the game-changing potential of healthcare, understanding the basics, etc., and then recognize the true potential of classics analytics versus what is really a machine learning. Interpret ML-based studies in healthcare. Again, we were brought up with classical analytics and ANOVA, t-test, etc., Bayesian statistics. But how are we going to interpret these new ML-based studies that are being published at a massive scale now? Analyzing these limitations of not only the studies, but also direct clinical, practical application of these studies as well. And then how can you potentially implement these clinical practice applications of machine learning? This covers the whole sort of the series of the primer. First and foremost, I would like to thank Eric Topol, who wrote the book Deep Medicine, How Artificial Intelligence Can Make Healthcare Human Again. Fascinating book. If you want to read one book, I think this would be your book of choice of reading deep medicine and deep machine learning in medicine. I do wholeheartedly disagree with the conclusion that he comes up with, that it can actually make healthcare human again. His whole premise of the argument is that as soon as we are actually have these machine learning applications, we will have more time to spend with patients. Unfortunately, the big healthcare corporations, which are turning into oligopolies, will squeeze every ounce of work from all clinicians, including physicians, providers, and nurses. And I doubt it that these improved efficiencies is going to translate into more humanly care for our patients. So before we, again, get into the whole what is machine learning, etc., we need to know why do we even need to apply it, and what are the current challenges of machine learning. And if you look through the lens of the past, how health IT, especially the implementation of EHR, impacted physicians, and how this is going to change the way we do medicine today and in the future. Interestingly, the book of Eric Topol discusses a flowery future, but interestingly enough, when you go and listen to his podcast, which is Medicine and the Machine, available on Medscape, you would see that he also goes back into it and discusses with Abraham Verghese, which is the director of President's Institute at Stanford, which is a cross-disciplinary institute to bring other technologies from other fields like engineering, computing into medicine and improve medicine and healthcare through that. And they both discuss these burning topics. Do we need to be more human? What AI means for a physical exam? And then he brings his first guest, which is Daniel Orphy, and discusses the most important topic, that is that AI may save time, but it can't listen to a patient, which basically talks about the limitations of how AI and patients and physician can interact all together. And then lastly, the most important topic, I think, spend money on AI, or just give doctors more time. And this is the crucial aspect of this particular topic that I'm going to discuss is it really worth it? Or is it going to be changing the way we are doing things for no good reason? And there's my healthy skepticism comes with proper data, and I'll show it to you. And lastly, Eric Topol discusses the most fascinating aspect that he has ever discussed, in my opinion. It's time for physicians to organize, and not unionize, organize. And I'll come to it in a minute too. So first and foremost, let's look at the past, the EHR and its implementation. Interesting article published, Death by 1,000 Clicks, where electronic health records went wrong. After 10 years and $36 billion later, apparently we never got the promise of the electronic health medical record. AI and machine learning has been touted as this is going to fix what we have always been wanting, a complete, fully EHR with proper analytics and point of care decision support. Unfortunately, it hasn't been what we have expected. And this is one of the things that makes me the most skeptic about implementation of machine learning in the physician space. And do any physician will ever have a say into how are we going to move this forward? So what's left with is basically physicians redefined as the highest paid data clerks. And that's the problem that we are looking at. If this situation continues to be forward, what is the role of physician? And we have been redefined right now as data clerks, in my opinion, with the EHRs, with the machine learning, AI, and properly some decision support. What would be the new role of physicians would be, especially in an inpatient setting? This is another beautiful article by Atul Gawanda, Why Doctors Hate Their Computers, and it just literally goes by paragraph, what was the promise and what is the reality, and does it actually make a difference? So we now turn to business of medicine. This is an excellent article by Daniel Orphy. She discusses how the basics of healthcare business depends on exploiting clinicians, doctors, and nurses. And she goes into it with great detail. Let me get into the salient points of the article. The healthcare system needs to be reconstructed to reflect the realities of the patient care. From 1975 to 2010, there has been an exponential increase in healthcare administrators. By definition, as she quotes us, 3,200%. Roughly now, there is 10 administrators for one doctor. She points out if we actually turn half of those salary lines into additional nurses and doctors, we might have enough clinical staff members to handle the work. Healthcare is about taking care of patients and not paperwork. People have multiple arguments, well, there are not enough doctors. That's not true, actually. There have been multiple physicians who are leaving the practice just because of the burnout and also because they are unjustly treated in their opinions. So if we take this into account, there can clearly be a way to move forward with less administrators. The promise of AI and ML is to actually automate a lot of this work, and this potentially can decrease the administrator workload and potentially open up some of these salary lines. Again, I'm skeptic. How it turned out in the past 10 years doesn't give me too much hope for the future. The other big thing that has been always been oversight is the monopolization of the healthcare systems, and hospitals. And this article goes into very detail on how it impacts patients and physicians. So we always talk about the raising cost of healthcare, but the raising cost of healthcare, one of the major things that is overlooked is monopolization of the market. So if you look at it, and I can give you examples. So for example, if you want care in California, you probably have to go to Kaiser Permanente. Cleveland Clinic basically monopolizes in the Ohio market. However, there's another big institute, which is academic, right across the street. If you keep going forward, you can see that markets are constantly being monopolized. Hospitals are buying another hospitals. Physicians' practices are being bought up by the systems. And then this way, they are squeezing out the competition. And once they have done that, they have raised the prices, because where are you going to go? The more consequential thing, in my opinion, is not just the healthcare markets being monopolized, because at the end of the day, there's a level of at the level of insurers that you can control the cost. But when the hospitals become monopolized, that has a much higher impact on everyone. When hospitals buy out their competition, the effect is almost always higher prices. Hospital consolidation can often lead to reduced access and quality of care. Again, all this is actually in that article with references. I've included all the references except for one, which you're going to see on the next slide. So this article is the growing executive physician wage gap. That was published in Clinical Orthopedics. And this graph, as you can see, states that national wages of healthcare have slightly improved, but at a very lower pace as compared to the national healthcare expenditure. And the wages become less and less of the larger portion of the whole expenditure. The second slide actually shows the graph that physicians and surgeons in the last 10 years only account for 5% of the total growth. As far as non-clinical workers account for 35% of the growth. So going to the same point again, we're hiring more and more administrators. And unfortunately, the people who are at the front line actually providing care are getting burned out and leaving the industry. Wage gap between physicians and CEO compensation has risen by 93%. Again, you have to remember, as compared to other industries like IT sector, etc., the gap is much higher. But because the reason for gap being higher is that the worker actually makes less money than an average physician, and the CEO makes a lot more. However, this has also traversed into healthcare, and CEO compensation rose by 93%, basically doubling all the way from 2005 to 2015. And this trend is not stopping. When the CEOs get higher paid, the next complete row of administrators get their increased pay as well. So CEO represents just one ladder. All the other ladders beneath it get increased compensation as well, which is different from other industries. In healthcare, all the other ladders also get significant increase as well. And for the first time in basically the whole history of US healthcare system, we see that since 2016, where physician-owned practice or independent physicians were the norm, now eventually it is not the majority. And this is a major shift. One of the biggest reasons for that is EHR and the cost involved with it. This comes to the next point. Eric Topol wrote this beautiful article in August of 2019, Why Doctors Should Organize. Meeting the challenges of modern medicine will require more than just seeing patients. And here he makes the argument where that organizations of physicians is extremely important, not just for physicians. As a matter of fact, he barely speaks about physician in this article, but more so for patients. And patients will actually be important in this situation. And this is one of the most important reads. I urge you to read this article. And I truly believe that, that physicians need to organize. Let me clarify. I'm using the word organized, not unionized. I do not believe in physician unions, especially for multiple reasons. I'm from Pakistan. I've seen what physician strikes can really worsen patients' access to care. And this is not something that I will ever agree to unionizing. But organizing is completely different. Organizing is to actually be able to facilitate moving of procedures and policies. And I think the most important one is that healthcare ownership should belong to patients. We'll all be patients one day, and our healthcare information should be protected, secured, available to all of us. And by definition, the ownership should belong to patients. You would not believe how bad the situation is. Again, when you go through these lectures, I'll go further into this topic in my challenges and limitations. Before we move forward with the second presentation, I want to go through the quotes to basically set a ground of priming your mind that how important all this is and why it is going to be game-changing. So the first and foremost is from Medical Genomics Director at Microsoft, Miller. Artificial intelligence has the potential to radically change the healthcare. And as a matter of fact, he actually goes into this article and discusses that AI and healthcare are made for each other. The data that is coming cannot be cleaned as well. For example, number of steps via Fitbit, simple, clean data. There could be measurement biases, measurement errors, but at the end of the day, the complexity of healthcare data is humongous. And to tackle that, artificial intelligence and machine learning is the way to go. That's tackling the current problem. The future, drug discovery, genomics, etc., are going to all depend on these machine learning applications to move the field of medicine forward and radically change it. Unfortunately, we all get into a hype. When we see a technology, we overestimate it. That's been going on right now. Machine learning and AI, and they're basically creating balloons of predictions of angels gonna fix everything, working on AI. That's true. I mean, we sometimes overestimate it. Unfortunately, what we tend to do is we underestimate the effect in the long run. And this is something that's more and more that I'm going to give examples moving forward. You're going to see how a difference that makes. Follow the money. At the end of the day, that's something that unfortunate, but at the end of the day, that's how the world works. In 2018, the market is $2 billion. And by 2025, we are looking at a $36 billion market. Again, which has enormous potential for patients and investors. Interestingly, not for physicians. This is the Washington Journal article quantifying the growth of AI in healthcare. Satya Nadella from Microsoft, artificial intelligence presents one of the most important priorities, and healthcare is perhaps AI's most urgent application. Most urgent. I think it sums it up. This is the most powerful quotations about machine learning and artificial intelligence. This is from the former head of Stanford AI Lab, Mr. New. And he says that even the metaphor of internet doesn't do justice to machine learning and AI. He compares machine learning and AI to electricity. Just as 100 years ago, electricity transformed industry after industry, AI would do the same. This is one of the most profound things that I've heard, and I have examples in the next lecture. Market insights, follow the money as usual. This is from CBC Insights. We're looking at how the amount of money going into healthcare AI has been increasing over time. Currently, it's about $7 billion. Similarly, this is from Accenture analysis, saying the same thing, that there's gone from 600 million to 6.6 billion. Again, there is a lot of market share that has been devoted to it, with a compound annual growth rate of 40%. Significant impact from an investor perspective. So next lecture will be overview and technical basics, and then we'll keep going forward in this primer for physicians. Again, thank you for listening to me. Please visit my website, provide me with feedback, and then definitely subscribe on YouTube. One more important thing is please share. I would really appreciate it if this is shared over LinkedIn, Facebook, whatever platform you're using. I would really appreciate it that you share this particular presentation.